I'm here with Dr. Nicholas Chadi, an adolescent medicine and addiction specialist in Montreal, and the author of a new CPS statement on youth vaping. Welcome, Dr. Chadi. Thanks for being here today.
Thank you. Thanks for having me.
So vaping we often see framed as a less harmful alternative to tobacco smoking in a more traditional form. How would you say that matches up with what you're seeing in youth?
I think we have to be very careful when we compare tobacco products and vaping products. One thing to know is that most young people who use vape products are not young people who are smokers to start with, or who would ever have used tobacco products. There are different sets of risks for both. We know about the long-term risks of smoking cigarettes, and we're starting to learn more about the short and longer-term risks of vaping products. What we should be telling youth is that vaping is harmful and carries risk, and it should not be considered a useful or effective smoking cessation tool for those young people who actually do smoke cigarettes.
Now, as a trend, vaping is still relatively new. What do we have in the way of evidence-based interventions and treatment options for youth?
So when we think about helping youth who have a vaping problem, really the gold standard here is everything around behavior and behavior change. So using strategies that we know from working with youth with other substance use problems, we can engage in motivational interviews. So we'll want to use some evidence-based screening tools for all substances, like the CRAFT tool or the S2BI tool. Those are short questionnaires that ask young people how many times they've used a substance, and that could be nicotine through vaping, for example, in the past year. And once we've heard about their use, and if they tell us that they have or they're considering using, well, then we'll want to engage in a bit more of a conversation to try to see what are their behaviors like, how often do they use, what types of products do they use, and then go on with some more counseling and information about some, but not all of the health risks related to vaping, so that we really can have a fair discussion, an open discussion that's non-judgmental, and that would help young people think about changing their behaviors if they're problematic.
When do you think primary care providers should begin having those conversations with their patients? At what age?
That's an excellent question. From looking at national data and even provincial surveys, we know that starting in middle school, so around age 12, young people start getting very exposed to vaping products. So what we recommend in the new statement is to ask all youth about vaping at age 12, and sometimes earlier if we think that they might be exposed through family members or friends. It's really important to have that conversation, and we can even have it with younger folks and with parents, because exposure to vaping through various sources is something that can be harmful for young people.
And speaking broadly, what should clinicians expect to take from this new position statement?
So in the short amount of words that we really tried to put as much information as possible on vaping products themselves. What are they? Where do they come from? How many young people use them, and why do they use them? We then go on to explain the different short-term health risks that we're starting to understand better, including injuries and respiratory harms, and also potential harms for mental health and risk of substance use disorders related to vaping nicotine or cannabis, for example. Then there's a nice section in the statement that offers different screening and discussion questions to have an interview around vaping, and we offer different terms that providers can learn to be comfortable discussing vaping with their patients. And then the final part of the statement focuses on treatment, so behavioral treatment as a first line, and then potentially using nicotine replacement therapy or other medications for young people who use vape products regularly. We also have a set of recommendations for providers, for community stakeholders, and policymakers.